Hello, everyone. Welcome to today's program, Advancing Evidence-Based Practice and Professional Case Management. Today's program is being recorded. Attendees are muted but may ask questions in the chat box. These will be answered at the end of the program as time allows. Attendees will earn 1 hour CE for RN, SW, and CCM credits. Upon completing the program, attendees will visit the webinar site to evaluate the session and download your CEs. Those seeking social work credits will also complete a 10-question quiz. Today, the CMSA Foundation brings us a panel of members who will share how case managers support an evidence-based approach to assist their clients in achieving their healthcare goals. Effective case management positively impacts the healthcare system, especially aligning with the goals of the Quintuple Aim, which includes improving health outcomes, enhancing the experience of care, reducing the costs of care, improving the care team experience, and addressing social determinants of health and health equity. Learn how you can shape case management through the sharing of process improvements and research results that lead to better outcomes for your clients served. And now to turn it over to today's moderator, Melanie Prince, who will get us started. Welcome.
Thank you, Ashton. So hello, everyone. I am Dr. Melanie Prince, a registered nurse and certified case manager who has served on both the National Case Management Society of Americas as a past president and board member, and now as a board member on the CMSA Foundation. I'm excited to serve as your moderator for today's webinar, Advancing Evidence-Based Practice and Professional Case Management, hosted by the CMSA Foundation. So thank you so much for attending. We are excited to share the work of the CMSA Foundation and how the foundation drives change through research and practice, in addition to talking about evidence-based practice. So hopefully, many of you in attendance are familiar with the CMSA Foundation. But for those of you who are not, and for those of you who may like a refresher on our why, I'd like to take a few minutes to introduce or reintroduce you to the foundation. So who are we? The CMSA Foundation is a 501c3 organization that is different from the national CMSA, which is a 501c6 organization. So as a foundation, our nonprofit status allows the organization to address specific causes related to a public need. So in our case, we are addressing the need to advance the practice of case management in ways that are evidence-based. We rely on research, and we embrace the process improvement for the overall good of excellent patient-client care and safety. So what is it that we do? To that end, the foundation, we accept personal and corporate donations, as well as fundraise to provide financial awards and grants to clinicians who are conducting research or participating in process improvement. You will hear more about what we do later in the presentation. We have been able to support the advancement of case management practice for more than a decade now because of the vision and wisdom of one of CMSA's great leaders, Margaret Peggy Leonard. She recognized the need to establish a different organization that would enable case managers to support case managers financially and with quality in the pursuit of care for our patients and clients. The foundation is her legacy, and many, many leaders have continued to work toward advancing the mission and vision of the CMSA Foundation. And because of the financial support provided to award winners for their diligence in research and process improvement, patients, families, staff, and communities have all been impacted. And we continue to impact all of these groups by the gains and improvements implemented via award-winning projects. Real change has occurred in organizational cultures, practice processes, communication patterns, and other strategies related to the practice of case management. And as we prepare for the National CMSA Conference, June 24th through the 27th in Dallas next year, the Foundation's board leadership wanted to host this webinar to not only talk about advancing evidence-based practice, but also to have you leave the webinar brainstorming ideas about how you can survey your own clinical practice and translate your award-winning work into an award-winning project next year. So today, we want you to be inspired by what you hear from this outstanding group of leaders, because our purpose is to articulate and answer questions about how what you do every day can actually fit into a process improvement framework or launch a research study. Our objective is to allow time for questions and have a virtual dialogue among our panelists, Alan Boardman, Patricia Noonan, and Kathleen Perry. And just a little note about Kathy. She's in the Pacific Northwest right now in the midst of a storm, participating in this webinar on generator power. So fingers crossed that we don't have any tech gremlins happening for the next hour or so. And with that, I will now turn it over to Alan for introductions and comments to level set on our topics. Alan?
Hello, everyone, and thank you very much, Melanie. It's such a delight and a privilege to be here with you this afternoon. My name is Alan Boardman. I am the president of the CMSA Foundation, and I'm so excited to have the opportunity to share with you today why the CMSA Foundation is vitally important to our field and how it advances evidence-based practices in the field of case management. So as all case managers know, work across the continuum of care is ever-changing. The healthcare industry is dynamic and ever-evolving. New models of care emerge continuously that create opportunities for case managers to demonstrate their impact. However, it's essential that case managers quantify the full impact of the outcomes they achieve using data-driven methodologies. This is necessary to attract more investment and funding for high-quality case management programs. The CMSA Foundation aims to expand the well of resources available to the case management field through support of research that demonstrates the full impact of integrated case management programs. The Foundation also disseminates best practices that can be adapted to diverse practice settings. The purpose is to build a library of evidence-based practices that case managers can consult for innovative ideas that have achieved proven results. Through the application of effective interventions, case managers can develop new programs or enhance and protect existing programs to adapt to fresh challenges. The resources available through the CMSA Foundation can be particularly helpful during times of change. As I mentioned, new models of care are emerging that emphasize value-based purchasing frameworks. These models mark a shift from transaction-based reimbursement to arrangements that reward providers for achieving better outcomes at lower costs. Just a few examples include accountable care organizations, certified community behavioral health clinics, and the innovation in behavioral health model. Again, those are just a few examples. But central to these models are integrated case management services that achieve outcomes aligned with the Quintuple Aim that Pat Noonan will be discussing shortly. Case management programs that address environmental factors like an aging population, the rising costs of chronic conditions, and alarming and unacceptable health disparities for disadvantaged populations will be especially in demand. As case managers, we can use our strong advocacy skills to develop innovative programs that deliver improved health outcomes, facilitate community-based recovery, and increase patient satisfaction. However, to successfully lobby for greater investment in case management services, data-driven approaches that yield a positive return on investment will be necessary to persuade regulators, payers, and administrators so we can get more funding. This will be especially important as changes to government-funded programs like Medicaid and Medicare emerge. The CMSA Foundation offers resources to case managers who want to design new programs and enhance existing ones to respond to these challenges and opportunities. We want you to see the foundation as a resource to help you navigate changes in the healthcare delivery system and negotiate value-based payment arrangements to enhance and preserve your case management programs. And now I'd like to tell you a little bit more about the mission and vision of the CMSA Foundation. The CMSA Foundation strives to increase awareness of the value and impact of case management to the healthcare industry. We're a nonprofit organization, as Melanie described, and we have a volunteer board of directors who donate their time and talents to this mission. They receive no compensation, and the foundation gets no money directly from CMSA. We raise money throughout the year to fund grants for case management research and to recognize achievements in the case management field through Practice Improvement Awards. The Practice Improvement Awards are announced each year, the winners, at the CMSA National Conference. The award winner receives a monetary award, and their project is also highlighted in CMSA Today. In 2024, the Practice Improvement winner was the Al Hada Armed Forces Hospital in Saudi Arabia. Their project improved the quality of life for stroke patients. Other examples of past award winners include projects that retained case management staff during the COVID pandemic, another one that reduced hospital readmissions through increasing patient health literacy and improved self-management of chronic conditions, and an integrated case management program that served individuals living with serious mental illness in the community following an acute inpatient hospitalization. The foundation aims to disseminate the best practices identified through research and practice improvement awards. We accept applications during the first quarter of every year, and our awards committee, which is currently chaired by Pat Noonan, evaluates the applications using established criteria. Of course, we do look for data that validates the outcomes achieved. However, we also consider how the innovations can be adapted in diverse practice settings. We endeavor to champion interventions that can be implemented by case managers across the continuum of care. Recently, we have built a library that is available on the CMSA Foundation website. It gives a profile of past award recipients, and we encourage you to check it out. We want to make the library as robust as possible, and towards that goal, we plan to review past award applicants to see if their project meets the criteria for publication on our library page. The reality is that just because a project did not receive an award does not mean that it did not identify a valuable best practice. The CMSA Foundation is limited in its ability to give out grants and awards by the amount of money that we're able to raise. We would like to do more. Currently, most of our funding comes from monthly donors, individual contributors, and donations made by CMSA chapters who conduct fundraising activities for the foundation. We also seek corporate sponsors for awards. In fact, we're pleased to announce that a Practice Improvement Award opportunity will be made available this January that focuses on improved management of insulin-dependent diabetes through the use of digital technology. This award is made possible by a generous donation from Insulet. The CMSA Foundation aims to become the leading philanthropic organization working to advance the field of case management. We want to increase access to case management programs that improve health outcomes for the individuals served. We're grateful to the donors, chapters, and corporate sponsors who support this mission. The Foundation's impact will be directly influenced by the amount of money we can raise to advance this mission. We also want to hear from you. We invite you to share your successes with us by applying for a Practice Improvement Award. The applications will be open in January. Also, if you have an idea for a research project that you would like to conduct, please contact us. We would be happy to help you develop a project that is practical and powerful. Now I'll pass the baton to Pat Noonan, who will discuss the value of research and practice improvements that are aligned with the Quintuple Aim.
Hi, everybody. Thank you so much, Alan. Before we get started on our second objective, I'd like to introduce myself. My name is Patricia Noonan. I am a registered nurse, certified case manager, fellow in case management, and a longtime advocate for professional case management. I've been a member of the CMSA case management community for about 20 years now. I've served on the CMSA board, and I currently serve on the CMSA Foundation board. I also chair the CMSA Public Information Committee. And finally, I'm also serving at my local chapter, the Case Management Society of New England, on their membership committee. I am very excited to be here today to share the important work that the CMSA Foundation is doing to advance case management practice, certainly into the future. All right, so here is our second objective for this session today, which is to identify the value of conducting practice improvement and research in professional case management as it aligns to the Quintuple Aim. So moving on to the next slide, you can see here an infographic of the Quintuple Aim, and certainly the 5 goals of the Quintuple Aim. In order to understand the value of conducting practice improvement and research in professional case management, first, we must recognize the importance of the triple aim, the quadruple aim, and now the imperative for the Quintuple Aim. So what is the Quintuple Aim and how did we get there? Well, some of you will recall that when the Triple Aim article was first published in the year 2008 by Dr. Berwick and colleagues from the Institute for Healthcare Improvement, that article caught the attention of the full healthcare community as well as researchers. It was a call to action for our entire healthcare system that said, in order to deliver quality, efficient care, the entire healthcare system needed to focus on quality improvement efforts around 3 goals: improving the health of populations, improving the experience of care, and reducing the cost of care. And it wasn't enough for just a focus on 1 or even 2 of the goals, but the Triple Aim made the case for focusing on all those 3 goals together. So the Triple Aim became a measurement framework for health systems to demonstrate quality of care and the value to consumers. And we can see that there were prior articles prior to the year 2008 that led the way to the Triple Aim. And certainly you can see the influence that the Triple Aim has had today on a value-based healthcare delivery system. So let's fast forward now to the year 2014. Yet another important article was published within the healthcare community. This article was published by Drs. Bodenheimer and Sinsky, both researchers, particularly in the primary care provider space. This particular article made a case for the Quadruple Aim, which called for adding a 4th aim that said, in order for providers of care to make progress on the Triple Aim, there also needed to be quality improvement, measurement strategy on those that work to deliver the quality of care, and that is the full provider care team. So that's when the Quadruple Aim became a focus, a larger focus beyond the Triple Aim to be the Quadruple Aim. Now, fast forward to the year 2022. In particular, after the aftermath of the pandemic, yet another important article was published within the healthcare community. That article was published by Dr. Nundy and some colleagues that said that in order to achieve not only the Triple Aim and the Quadruple Aim, that there also needed to be a 5th aim, which focused on advancing health equity. There needed to be quality improvement, dedicated efforts to reduce healthcare disparities and addressing social determinants of health. So you can see here that the Quintuple Aim really reflects where we are today, where there is the imperative to focus on all those 5 goals of the Quintuple Aim. All right, so moving on to the next slide, let's focus on identifying the value now of case managers within the case management community, actually conducting practice improvement and research, and how those interventions and outcomes, sharing those interventions and outcomes actually align with the Quintuple Aim? Well, here you can see on this slide the 5 goals of the Quintuple Aim. And you can see the research and the focus on why focus on those particular Quintuple Aims, the problems that exist that are aligned with those 5 areas, those 5 domains. So as it pertains to population health, we know that research has proven that there is a problem that exists to focus on population health. We know that chronic diseases are the leading cause of illness and disability and death, certainly in the United States. So why should case managers focus on conducting practice improvement studies or research as it pertains to population health? Well, we cite one study here that says case management has proven effective in the treatment of many chronic diseases. This particular research study goes on to say that there is evidence of improving population health with a focus on the diabetes population, the chronic lung disease population, the hypertensive population, and the cancer care population. So next, looking at the goal of enhancing the experience to care. Well, we know research says that negative patient experiences in healthcare correlate with poor clinical quality, safety, and efficiency. So what's the value of case managers actually conducting practice improvement and research as it aligns to the experience of care? Well, one research study cites that case management has shown to improve satisfaction and quality of life. So next, looking at the 3rd aim as part of the Quintuple Aim, which is to reduce the costs of care. Well, we know there is a problem in terms of costs, and certainly within our healthcare system. We know that research says that chronic diseases are the leading drivers of our nation's $4.5 trillion in annual healthcare costs. So what's the value of case managers conducting practice improvement studies or research as it aligns to the cost of care? Well, here we cite one research study that says case management interventions favorably affect healthcare utilization. So next, in looking at the 4th aim of the Quintuple Aim, which is to enhance care team well-being. Well, we know research says that burnout among the healthcare workforce threatens patient-centeredness. Care team burnout also contributes to overuse of resources and increased costs. So what's the value, once again, of case managers actually conducting practice improvement and research as it pertains to care team well-being? Well, one research study cites that the key to success of the work of a case manager and case managers is the ability to establish trusting relationships, not only with their patients and clients and their families and caregivers, but other members of the caregiving team, the provider team. And finally, in looking at the 5th aim, which is to enhance health equity, we know a major problem exists, and research has shown that says inequities in health and healthcare lead to poorer health outcomes, premature deaths, and drain healthcare resources. So what's the value of case managers conducting practice improvement studies or research as it aligns to enhancing health equity? Well, here we cite one research study that said case management services improve clients' ability to abstain from drug use, reduced social problems, supported unmet service needs, and improved satisfaction. So here you see just a handful of the evidence that exists today by case managers actually demonstrating the value as it aligns to the Quintuple Aim goals And finally, in closing here, I would say that by conducting practice improvement or research studies and demonstrating as it aligns to any one of these goals of the Quintuple Aim, you as a case manager are actually demonstrating that you're following one of the standards of practice for case management that says it's important for case managers to engage in quality management, health outcomes improvement, research, and dissemination of that knowledge and practice to the full healthcare community. And finally, by doing so, you're actually contributing to the evidence base in support for professional case management practice. All right, so lots of good information there. And now I would like to turn it over to my colleague, Kathy.
Thanks, Pat. Hopefully you can all hear me. I am not coming on camera as it makes my presentation unstable. So my name is Kathy Perry, and like Pat, I am a registered nurse and certified case manager. I am also a board member of the CMSA Foundation, as well as a board member on the national CMSA board. I am the chair of the education committee, as well as being very involved in both the WMCMA, which is the Seattle chapter of CMSA, as well as the Spokane chapter of CMSA. And I'm delighted to present today the third objective of discussing ways to engage the case management community in conducting practice improvement and research projects to advance case management practice. I am a former award winner of the Process Improvement Award in 2022. Next slide. So how are we going to engage our case managers in practicing process improvement and or research? We positively impact clients in navigation of the healthcare system on a daily basis. Case managers do process improvement every day, and we don't think about how we are doing process improvement. We just think of it as our daily work. And we are also the best kept secret in healthcare, as we keep reiterating, even though we've been around for forever, as I would say. We need to show what we are doing and how we improve clients' healthcare and navigation, and show it to the community, our places of work. And we are very shy about doing this. This also shows our value as case managers to the organizations. And it is important, as many organizations question our value in their organization. And without showing how we do it, we are at risk of potentially not having case managers within the organization. Due to most organizations, we are not in the revenue producing area of case management. So engagement in practice improvement can seem difficult. However, it is really not that difficult if you break it down into small bites. For instance, patients transitioning from the hospital to home, that is a huge area for dropping the ball in without having the right supports in place. So one of the ways that people actually, or organizations actually, look at the readmission prevention is their transition of care calls, to follow up after members or patients discharge from the hospital by doing care coordination calls, transition calls, post-discharge calls, whatever you want to call them, and seeing that this patient went home with the right resources. Did they get their home health order and is it in place? Did they get their medication? Do they have follow-up? Do they understand what is going to get them into trouble? And this helps promote, promote readmission prevention. However, have we shared this with people? How do we share it with our organizations? That is one way we can do it. And when I won my practice improvement award, or was awarded the practice improvement award, we took the next step with this transition call. It was during COVID, and it was noted that patients were at risk for readmission within the first 7 days of hospital discharge from the hospitalizations if they were discharged home on oxygen. So during this time, we added extra calls to these members, not only to do the traditional transition of care call, but we followed up with 4 additional calls in succeeding days to make sure these patients.
Uh-oh, we may have lost Kathy. Kathy, if you can hear me, your sound has gone out. So we'll give her a few seconds while we wait to see if Kathy will come back. Let me just say that I've got to acknowledge what Alan, Pat, and Kathy has shared so far. You have heard from Alan, who went into an excellent deep dive into what the foundation does. He gave you all examples of previous award winners, and hopefully that has inspired you to think about submitting a package for next year. And then Pat comes in with the Quintuple Aim. She ties it into our CMSA standards, our case management standards, and then she has that power slide where you can take this back to work because it demonstrates the values, and then it has the research studies to back it up. I call that a power slide. Pat, I plan on stealing that one from you. Thank you very much. And then Kathy has started to talk about, Kathy, are you back?
I'm back, but you finish up.
Yay, well, you continue to give your testimonial about what it's been like to go through the process. Go for it.
Sure. Okay, thanks, thanks, Melanie. So as I was saying before the internet dropped me, was I took a step on top of our regular transition calls during the COVID pandemic, where patients were discharged on oxygen. And we did an additional 4 calls daily after their discharge to make sure they understood. We checked their symptoms. We made sure that they had their follow-up. And ultimately, with that patient population, we had a readmission rate of 1% from the group of patients that were discharged on new oxygen after their COVID diagnosis. From that, we had 3 patients that were, based on the call, were sent back to the emergency room to have follow-up. We had 1 patient unfortunately expire. It was hard to say whether we could have intervened as that patient was on hospice, so as they went home, so that we may not have been able to affect that. But overall, our work with COVID prevented readmission, which was helped in an overly burdened situation in hospitals during the pandemic. As a result of the award, I was recognized throughout our organization, and ultimately the plan was to potentially spread it throughout the multiple regions. However, I'm not sure whether that actually occurred or not at this time. So we need to share what we do, and this is really evident in our daily work. It is not hard. It seems hard, but it really isn't hard. However, we do not like to promote ourselves. And I know in my own way, I don't like to stand on a soapbox and promote myself. I just like to get in there, do the work, knowing that I'm affecting my patient, helping my patients get the best care at the right time, right place, and move forward. Let's move to the next slide to look at how we can do process improvement. So we can do practice improvement can be identified through multiple ways, including intervention support, tool development, process improvement, and assurance of outcomes or data. As I said, my project was related to readmission prevention, protocols to improve patient satisfaction. So what are we doing to enhance patient satisfaction? And that could be anything from developing a tool for having somebody go through a protocol on how they're handling their diabetic management. How are they working through doing protocols, understanding CHF? There are some great tools out there related to heart failure that are step-by-step projects as you're working with a member to understand CHF and breaking it down so that protocol, as you're stepping it through, giving them a definition of CHF, understanding their meds, understanding their exercise, understanding their diet, moving through. And there is research there that identifies that if they have 9 touch points within a year, they significantly reduce their readmission. And initially, the initial touch points with that are weekly with over a 6-week period, and then it goes to monthly for approximately 3 months, and then they have a touch point at a year. And that protocol really helps those members, patients, move through the system and stay as healthy as they can be. Processes to reduce fragmented care. Transition calls help with that. Identification of SDOH needs, food insecurity, transportation, especially with transportation, if you've got a member that needs a primary care visit and a specialty visit, and they have transportation issues, let's look at combining those appointments potentially on one day so that their transportation can be arranged to move forward. So let's look at those types of processes. And then the ways to share that how we can do that is submit for the Practice Improvement Award. When I looked at it, it looked very daunting, but if you break it down, it is not as daunting. So one way is to identify the project. For instance, as I did it, was we did transition calls. We know we do a great job with that, but there was an area where there was a need. Identify that and then see how you can develop a protocol. So you're planning it. And then in the award submission, what you're looking at is you're summarizing what you're doing and how you did it. And then the next thing is to do, which is your part of data collection. So you have a way of collecting the data, and then so you're going to follow through with that and identifying it. Which way are you collecting data? Where are you collecting your data? Medical records, actual patient calls, patient calls, and then and you need to describe it. And then you're going to check and see where your interventions are, and do you need to adjust that? And it steps you through, the application steps you through. And actually, if anybody is interested in doing a process improvement or a practice improvement, I'm willing to help step you through the process. It seems daunting. It is not as daunting as it seems. And then you need to share your successes with your coworkers, with your upper leadership, with the organization, and then
Uh-oh, I think that little gremlin is back. Well, Kathy is giving some great examples of how to get started on a process improvement. If you all are familiar with process improvement, she just talked about the plan, do, act, check cycle. Very simple. Just take what you're doing every day, just like Kathy said, what you're doing every day. I know that you are doing process improvement. Put it into the plan, do, act, check cycle. Put that into the framework, use existing tools that are already out there, and then take what might appear to be a daunting application, break that down into parts and pieces, pick up the phone. Some people still actually talk on the phone. Pick up the phone and call somebody, one of us. We can help you with that application, or certainly go online, take a look at it before you even get started, and you can have an idea of what you'll need, and just do all of the things that she's talking about on the slide. And we would love to see you apply for a practice improvement award for next year. So hopefully she'll come back. But let
I'm
me
back
encourage you to, I'm sorry, are you back, Kathy?
Back again.
Yay! All
This
right.
generator thing is just,
Hey, you have a
being
generator.
involved.
That's wonderful.
Yeah, we have a generator that's been running, so, but it's just still, it just blocks in and out. But anyway, doing a blog, like I was saying, what is 500 words. It's great. It's a way to tip your toe into writing. So it's a way of sharing your success, whether or not you apply for a practice improvement award. But I think everybody can apply for a practice improvement award. We are doing things every day that we can share our success. We are behind the 8 ball, so to speak, to as related to other fields, that we are not showing our work, we are not sharing our work, and we need to share our work. And then also writing an article. If you break it down, like Melanie was saying, a blog is a start to an article, and then you can add on to an article. And articles don't need to be 5,000 words. They can be 1,500 words. So if you look at a blog is 500 words, 1,500 words is 2 blogs. So you just kind of expand on what you wrote in your blog and then have references within that. But overall, I really think every one of us can do a practice improvement award. It may not be something that's truly new, but something we are doing to improve our patient care, including patients. It will improve patient satisfaction.
All right, if you all are not inspired by Kathy, I don't know how to do it. I feel like walking out of this office right now and getting started with something. But let's do this. I want to make sure that all of you are reminded to put your questions into the chat. We have about, I don't know, maybe 10, 12, 15 minutes or so left. So we want to leave some time for questions and answers. So put those questions into the chat. And I want to go back to our amazing panel and just kick this Q&A part off with a few questions that I've thought about as you all have been talking. So, Alan, Kathy sort of ended with make sure that you share the information. Don't let this be a best kept secret. So, Alan, how are Foundation Award winners recognized for their contributions?
Thank you, Melanie, for that question. So it's really in a variety of ways. First of all, we do announce the award winner at National Conference. So everyone who attends has an opportunity to hear a little bit about their project, and they receive an award there. They also get a monetary award of about $1,500. So that's always nice to have. Last year, actually, it was really exciting because the award winner flew all the way from Saudi Arabia to Providence, Rhode Island. to accept the award in person. And the joy on her face was just unforgettable. They were so proud of their project. They were so thrilled to be recognized by CMSA. So it was really very special. And additionally, the award winner writes an article for CMSA Today that is published. Also, it appears, on the website. And again, as I mentioned, it is in the CMSA Foundation Library. And we continuously try to drive traffic to our website. Everyone who's on the call today, please go to our website. It's cmsafoundation.org. And see what's available there. You can read profiles of past award winners and research grant recipients. We want to see your name there. We want to see your project there. And that's one of the ways that we disseminate, kind of the best practices that have been identified.
That's awesome. Great. Thank you so much. And Pat, so you did an amazing job with that. Well, you did an amazing job overall, but that one power slide that I really love, you had, the aims laid out on the one side, and then you had your examples, really specific examples on how to align those, and then you had the research studies. So here's my question for you. So one of the quintuple aims is to support healthcare provider well-being. So let's get down to like a very specific example for our audience. So how can someone who has organizational metrics that are already established? I mean, I know there are places that are measuring staff satisfaction or burnout rates or peer-to-peer support or even continuing education hours. How can these kinds of measures or metrics be used to develop a research study or a process improvement project?
Great question. So here I would say, Melanie, that in particular, case management leaders are in a great position to focus working on the one of the Quintuple Aim goals, which is focusing on enhancing care team well-being, particularly at a time where workforce retention really has become a priority across the country, our workforce retention. And if you have the leverage as a case management leader, certainly within a large organization, typically conducts employee surveys. So take a look at what you are learning. A practice improvement study can really be based around improving care team well-being. What are you learning from your employee surveys as it pertains to your team, your staff? Looking at what are they saying to you? Where are the gaps and where are the areas for improvement as a case management leader? Is it around continuing education? Is it around further training that they're reporting they're needing and are dissatisfied with the current structure? Is it around receiving support for achieving certification, not only funding, but also mentoring support? Is there an opportunity for a leadership ladder to promote future case managers getting into case management leadership roles? So look at that. Take your employee survey, look at where the gaps are. Where are there opportunities to improve? And one final word there, having been in case management and leadership for quite a number of years, is bring those results and discuss them with your team. Start right there. Engagement is critical. Let the staff know that you are listening, that you appreciate the feedback. Clearly, those results are typically anonymous, but that is engagement from the start, where staff will be heard, will feel like they're being heard. They'll be invested in seeing a change and improvement. And again, I would say here, don't forget that when you conduct any kind of practice improvement or research, you can incorporate process measures as well as the outcomes measures. So there's a great opportunity, and I believe case management leaders are in a perfect position to look at the care team well-being and use that particular aim as a focus. for quality improvement.
Oh, Pat, that was fabulous. I have to believe that everyone on this call can relate to something you said. I think I heard at least 10 projects in your examples, at least. So hopefully that's resonating with everyone. I want to take a question from the chat, and I will throw this out to the entire panel. So whoever would like to answer, please jump in. So the question, any thoughts about how case managers can identify health disparities and improve health equity? How can this translate into a practice improvement project? Any one of you can jump in.
So this is a question that's near and dear to my heart. So Michael, thank you so much for presenting it. So, I work, at a health plan. It's a large health plan in New York City. I specifically work in the behavioral health department, and we do a lot of work with individuals who have serious and persistent mental illness, but they also have co-occurring physical health conditions. And as you can imagine, really serious social determinants of health issues that can oftentimes be barriers to accessing primary care, specialty care, and promoting wellness. So I think, first of all, to identify where health disparities exist, I think that information would be available through population health data that you can probably research online. Oftentimes, it can be along racial and ethnic identities and cultural identities. But, also, of course, we know that individuals who do have co-occurring serious mental illness have a life expectancy that's probably 15 to 20 years shorter than the average population. So right away, if you're working with that population, there is tremendous health disparity there and a strong need for integrated case management programs. One of our past award winners is with the CBC IPA. I think that stands for Coordinated Behavioral Care. And they have a program called Pathway Home, which is still in existence today. They won the award in 2019. It's a beautiful model. It's an interdisciplinary team that does field-based case management work for a period of 6 to 9 months after an inpatient hospitalization. And they engage the member typically while they're hospitalized and then continue to follow them in the community. They do an assessment, a very comprehensive assessment of both their physical health needs as well as their behavioral health needs. And of course, they also address the social determinants of health that impede access to physical, to primary care. And they do a lot of training also on better self-management of chronic conditions. So I think the information is out there pretty readily about how to identify health disparities, ways to improve health equity, can certainly be using an integrated case management approach, looking at both behavioral health conditions and physical health conditions. We know that when behavioral health conditions go unmanaged, that they tend to exacerbate any chronic medical conditions that the person has. Oftentimes, that also drives up costs and reduces the person's community tenure. So, but advocacy also is a strong way to advance health equity. I think also when we're talking about metrics to evaluate process improvement, if you can get access to cost data, that's always wonderful, but not everyone has access to that. So if you don't, doing even pre and post intervention assessments using the same assessment tools and showing progress or a reduction in symptoms or shifts in symptoms and tracking that can also be very good outcome data that you can show. If you show a reduction in depression, that's great. If you show an improvement in medication adherence, that's wonderful. And also just improvements in patient satisfaction. Increasingly, the HEDIS scores are driving revenue for the health plans. And the patient satisfaction component, which is the CAP score, is very tricky. It's somewhat of a random questionnaire, so you never know who's going to get it. But if you can demonstrate through your case management interventions that you're improving patient satisfaction with their health plan, that's going to be very valuable, and it's an important thing to capture.
Thank you so much, Alan. I appreciate that. And I just want to recognize Ms. Heidi, I'm not going to say this right, Steinobel, who is affirming what you're saying, Alan. They identified health disparities in a population as they were not having their blood pressures managed as well as others. And they were able to get blood pressure machines and provide dedicated education with this population and provide the equipment. And they're seeing hypertension control improving. And that's a great example of what we're talking about. It's the work that we're doing every day. And all we need to do is fill out that application, submit that, and we would be happy to consider you for a foundation award. Now, there was another question. I can't read it verbatim because my chat's going up and down, but it essentially was asking if we are sharing some of these projects and the outcomes with the Centers for Medicare and Medicaid Services. And I think that's a great question. One of the things that we are working hard to do is to improve the dissemination of what we are doing as a foundation. Kathy talked about blogs and articles, and I think going forward, we will continue to do more webinars like this one. We have a few people on here. We hope that this will be about 400 voices that go out into the world and talk about what we're doing today. And we will definitely be very intentional about making sure that CMS and others hear about the outcomes that we are achieving through the work of the foundation. So thank you for that. I know we're getting close to time. Kathy, are you still on? Is that generator still working?
Generator is still working.
Okay, I just want to try to get in a quick question for you because again, you have that testimony. You're one of the panel members that was an award winner. So as that previous award winner, how can someone out there communicate their idea for a process improvement or research study submission and really rally their leadership or their department around the idea so they don't have to feel like they're going at it alone? You know, what's that magic dust?
Well, so I'm going to go on Pat's last comment related to, the staff satisfaction surveys that come out. There is usually something in there that comes out, and I've been in leadership as well, and you present the information to the teams and identify, okay, what do you want to work on, and leave it to them so that they can come back to you and say, hey, and I'll just go on with Heidi to say that they wanted to work on better blood pressure management. Bringing that to leadership to say, hey, I have all these patients that aren't controlling their blood pressure. Let's look at something that we can do to promote that. And yes, is it a cost of the system? Initially, that outlay is there. However, down the road, if these patients' blood pressures are managed and they're managing it with their meds and everything, it's a decreased cost to the healthcare system. So that is showing what you can do and promote it to the leadership to say, hey, this is what we came up with. Let's try it. Let's run with it. The other piece is in your staff meetings as a group of case managers, you can come up to your management, whether it's your manager, your director, or even your VP, to say, this is an area where we see a need. Can we do a short-term project just to see, what the outcome is? And, it can be negative, it can be positive when you can share both results, and then leadership sees that you're invested in.
Oh, I think we know how that was about to end.
No,
I'm sorry, go ahead, Alan.
No, I'm sorry. We just had one comment in the chat about if anyone is interested in doing a research project, could someone on the foundation board serve as a mentor? And I think that the answer is yes. We'd be happy to, help you shape your thoughts about that and make some recommendations. So please just reach out to us, and we'll be happy to help you.
That's great. And then I also saw in the chat, I want you all to know that we love, love, love seeing everyone at conference, but don't feel like you have to go to conference in order to apply for this award. So I don't want to miscommunicate there. Please consider applying for the award, but going to conference is not a requirement to apply. So I wanted to clear that up. Okay, we are out of time. I just hope that your takeaways from our webinar today was that you individually can advance evidence-based practice in case management, because I guarantee you, you are already doing it. We have given you examples of what's happening out there in clinical practice. We've given you examples of tools. There's research studies that you can use. We've put into the chat the links of where you can go and look at previous award winners. You've heard a lot about the foundation. Alan is the president this year. So there's absolutely no reason that you cannot walk away thinking, I am going to go to work, look at all of this good stuff that I'm doing for patient care, and convert that into a practice improvement award or a research study. But we are very happy that you joined us today for the webinar. We hope you got something out of it as much as we got a lot out of it, just sharing this information with you. So thank you very much. And this concludes our webinar session today. I am going to turn it back over to Ashton to close us out.
Thank you everyone for attending. Just don't forget to go do the questions on the educational library page for this webinar, and it has been recorded if you want to come back and rewatch. Thank you.